I had been plagued for years since I was a teenager with heavy and uncomfortable periods, a lot of pain. I knew I wanted to have children, so I went through that in my life, and had a lot of, tried different things, medications, seen different physicians, and just kind of been through a lot. I started seeing Dr. O'Toole for some different things and telling him kind of what was going on and how each month was kind of getting worse for me and uncomfortable, and how frustrated I was just with every month it seemed to be getting worse. He has been very compassionate with helping me find the right, or helping me make the right decision for my body and my choice for my quality of life that I was looking for. He was very good with answering all my questions. One of the options, probably the most final and permanent option, was to have a hysterectomy, and initially that sounded the most appealing, but the thought of surgery is scary, and I was really hesitant. I had heard I knew lots of women that had hysterectomies, so I was just figuring it would be a long recovery period. So I continued to go back and ask more questions and find out what the risks and benefits of the procedure were. And finally I made the decision to go ahead and have the procedure done. So we scheduled the surgery, and he was very good at kind of telling me what to expect and explaining that it would be an overnight stay at the hospital, so just really brief, within 24 hours. Shortly after waking up, I was able to get rid of the oxygen and have the IV taken out, and I started eating. I did spend one night in the hospital, but it was basically just the nursing staff checking on me and making sure everything was going okay. The next morning, nurse practitioner came in from Dr. O'Toole's office, and she just checked me out and discharged me. The one thing that I was absolutely shocked about is that there was absolutely no bleeding after the surgery. My incisions were very tiny, and I kept asking the nurses if that was normal, if that was okay, and she thought that maybe once I got a little bit more active that that it could pick up and that could be something that I would experience, but there was really nothing. So that was something that was amazing to me. My life is so different after the surgery. I really, the only thing that I regret about having the surgery is that I didn't do it sooner. My quality of life is much better because of the surgery. I would recommend anybody who's been thinking about having a hysterectomy to see Dr. O'Toole or one of his associates to talk about this option. Again, surgery isn't anything that anybody should take lightly or rush into, but if it's something that you've been contemplating or something that you think would really enhance your quality of life, I think these tools make it that much easier and really bring that quality of life back quicker and easier and less pain.